Since in general we feel, and I personally feel that awareness for chronic pain is needed, and a pain specialist plays a very major role when it comes to chronic pain. Here we are with Dr. GP Dureja, who is the director of Delhi Pain Management Center, to talk about what is the basic role a pain specialist plays in managing chronic pain.
Good question. You are asking, since chronic pain is now a disease, we don't consider chronic pain as a symptom, but we consider it as a disease because it has manifestations on the whole of the body, like the social manifestation, psychological manifestation, systemic body functions, like even the heart rate is affected by chronic pain, the kidney blood flow is affected by the chronic pain. So if any symptom has effect on all of the body, we always treat that symptom as a disease. So in 1995 and in 2005, WHO declared chronic pain as a disease rather than a symptom. So when chronic pain is a disease, you should have specialists to manage that particular symptom. And that's why the role of pain clinician is very important. Because what we are envisaging is a holistic management of chronic pain in terms of a complete care of chronic pain, in terms of a spiritual care, philosophical care, psychological care, and of course, managing chronic pain. So if you consider chronic pain as a disease, you need specialists and pain clinicians are there to manage patients who are suffering from chronic.
So people don't understand that in India in general.
Yes.
So, and pain specialty is very new in India.
Sure.
So what is there that a pain clinic in particular does, and how a pain specialist plays the role? As in, when should in general a person in pain should come to a pain specialist, and if he is in pain for a very long time or what? How do you define it? That a person should come to you. When is the time?
Yes. See, we are considering even acute pain as a state where there is a tendency to that pain to become chronic. So we are sort of requesting everybody, if you have a pain persisting for more than 2 weeks, better go to a pain specialist because we don't want that pain to become a chronic pain. Because what we have seen that people who are suffering from chronic pain, it is a very difficult challenge for the pain clinician as well as for the patient to take care of that chronic pain. So in view of that, any patient who has pain for more than 2 weeks should consider himself to go to a pain clinician. And when in a pain clinic, you asked me what does a pain clinic does. In a pain clinic, we try to find the cause of chronic pain. Very, very important. We try to find the effects of chronic pain, whether the chronic pain has affected the body function, whether the chronic pain has affected the mind functions, or whether the chronic pain has become a disability for that patient. So the assessment, the chronification, the quantification of pain is done in a pain clinic, and based on that, we try to find a treatment for that. And not only treatment, we have to rehabilitate a patient of chronic pain. So all these aspects are looked after by a pain clinician in a pain clinic.
So, that the way you said it, rehabilitation requires your diet and your physical therapy and everything.
Yes.
So, how much role does physical therapy and diet plays in it?
Yes, diet and physical therapy are very, very important consideration if you are asking me in terms of rehabilitating a patient with chronic pain. Diet, there are a lot of studies being done in the US and in other Western countries where they are finding there is a definite role of some specific diet in managing conditions like fibromyalgia, like a gluten-free diet or antioxidant containing diet. So studies are still underway, but definitely in the future, diet is going to play a very, very important role. And the second question about physical therapy, I think pain management has to go hand in hand with physical therapy. May it be some simple exercises, may it be a lifestyle modification, or may it be specific physiotherapeutic exercises or modalities to treat chronic pain. So both diet and physical therapy are very, very important components of managing chronic pain.
So, you believe that pain specialty, along with all the other modalities, come together when it comes to managing chronic pain?
Absolutely. Initially when pain clinics were set up in 1960s, it was thought that it will be a multidisciplinary team where all the specialists will sit together, like a physiologist, like a psychologist, like a pharmacologist, neurologist, neurosurgeon, surgeon, orthopedic surgeon. They'll all sit together under one umbrella and manage because so much was the effects of chronic pain. But in India, the infrastructure does not allow us to every specialist to sit in. So it is the pain clinician who will be the coordinator, but he will keep referring the patient to a dietitian or to a physical therapist for considering these aspects of managing chronic pain.
So if I ask you one question, one advice you have to give to every person in India who's suffering from chronic pain in general, what would it be?
See, basically, what we have seen that managing chronic pain is very expensive. You would have seen by your personal experience, lot of investigation, lot of tests, and lot of treatment modalities which are very very expensive. So one we are always saying that prevent chronic pain. So you would ask me, can we prevent chronic pain? Yes, we can prevent chronic pain by managing acute pain aggressively. So if a person, any layman, if he has acute pain, he should immediately go to a doctor, any doctor, maybe a family physician or an orthopedic surgeon, and try to find the cause of pain and manage it. And as I said, if the pain is going beyond 2 weeks, then he should consider going to a specialist pain clinician so that his pain is not prolonged. If it is a prolonged chronic pain, it is a very, very important, very, very difficult and challenging condition for both for the patient as well as for the treating doctor. So I would rather give a message that chronic pain can be prevented, so acute pain should be managed aggressively. And if you have a pain of more than 2 weeks, please consult a pain physician.
Sum up, you can sum up.
So I would say that what Sir tries to say is you shouldn't ignore pain at all. Don't let it turn into a chronic state of pain. When it is in acute state, you should immediately see a doctor, be it a general physician or somebody. And if you can meet a pain specialist on the right time, you can get better treatment and management on correct time. Thank you.